maybe I might just want to make a few comments, just to put the presentation in perspective. Pero first, yung historical perspective. I think one of the conclusions here is that we don't really have a very good track record for infrastructure. I think we have to accept that. And I remember very early on, when I was very young in the DOH, and Secretary Bengson was the secretary. And he visited some of the provinces. No? And one of the conclusions that we're making were that many of the World Bank funded RHUs were either incompleted or if completed, were not staffed. It's the same conclusion here. So I think you have to consider that as a lesson in the way we manage our infrastructure, whether it's built by DPWH or privately contracted. We have to accept that. The second, and this just goes back, sorry if, my business comparisons are my experiences. But during my time as secretary, we only had a 10 billion budget. Meron kaming version of HFEP noon, which was not labeled HFEP. But the hospitals, if they had any surplus money, anywhere from 0.5 million to maybe 2 or 3 million, they'd improve their outpatient facility, or they'd improve their emergency room. We were not able to measure any utilization increases there. But if I were to connect it to what you found, that there was improvement in utilization in the hospitals, I would make this observation because we just go to Northern Samar and there's a district hospital there. And the environment's really unpleasant, even in the ward. So if the HFEP project is able to make a facility livable, chances are they'll be able to admit more patients. And that's what you've been measuring. Number of patients that come in. Because you actually say you don't even increase bed capacity. Pero increase yung utilization. Na-improve lang. Maybe the ventilation got better. It was painted better. And maybe the hospital staff, kasi hindi na tumutulo yung ward eh. The hospital staff can then use the ward. Whereas before, it was underutilized. And that, I think, is the reason for the increased utilization. Pero if I were to connect that to your conclusion, sa RHUs, walang utilization. Ang explanation ko dyan is that, most likely, hindi nag-increase yung manpower mo sa RHU. Yung mga doktor doon. So, even if you build a better RHU facility, which is not really increasing space for beds, maybe pinaganda mo yung waiting room, which I've seen in Samar, or hindi na pina-improve mo yung lakaran. Nag-improve yung environment, pero the capacity of the RHU to increase service to patients is limited because of your human resources. Whereas in the hospital, mas madaming mga tao doon na staff. Tapos may excess capacity ka na hindi ginagamit kasi bulok. So that would be my explanation for your conclusions. The last thing is, if we were to, it goes back to Lilibet's comment. If you look at the question, does enhancing infrastructure lead to increased utilization? I think the question we have to ask yourself is, what are the determinants of utilization? And you've actually mentioned the confounding variables, no? But I might mention a few. Okay, not necessarily operational in all, pero I would imagine kasi kung nag-improve lang yung hospital, and that was already some indicator of improving the urban environment, pwedeng nag-increase yung population in the area. is that for some reason, you could also postulate increase in disease incidence, kaya mas madami nagpapatingin. You know, those are the things you have to look at. Or, increased access to the facility, because maybe mas madami na yung mga tricycle na better transportation. And then of course, if the provincial officials were managing the hospital better supply side, more capacity, human resources there. But I would say that because of our studies in Eastern Samar, malaki yung effect ng social insurance. So the fact that there was increased enhancement of the facilities, coupled with the social insurance, as you said, yung mga doktor mismo magdadala ng mga pasyente doon. Kasi in many of the remote areas in Northern Samar, yung mga doktor, they're probably richer than most of us because of the PhilHealth reimbursements. And I think that would explain, to a great extent, why better utilization once you've improved the facility.